How to stay calm during a coronavirus outbreak. With the news filled with frightening stories about the new coronavirus, COVID-19, it's easy to feel anxious. It's natural to have some anxiety about any major disease outbreak, and you're not alone in feeling worried. At the same time, you likely don't need to be worried, especially if you're already following the CDC's advice for protecting yourself. Fortunately, there are things you can do to put your fears at ease. Method 1: Developing a realistic mindset. 1. Get your information from trustworthy sources, such as the CDC. You're probably seeing a lot of stories about the coronavirus, and some of them may contain inaccurate or outdated information. Additionally, you might encounter some myths on social media. To ensure that you're getting accurate and reasonable information, stick to sources like the Centers for Disease Control and Prevention and the World Health Organization. Visit the World Health Organization website for up-to-date information about the current COVID-19 outbreak. You can also find information from the CDC website. 2. Limit how often you check for news updates to once or twice a day. While it's good to stay informed, constantly reading or watching news updates can quickly become overwhelming. Instead, designate a specific time to check for updates so you're not thinking about the virus all day. Don't visit news sites or turn on the news outside of these times, and avoid social media if you're seeing too many updates there. For example, you might watch a news program in the morning and check for a second update in the evening. 3. Focus on the fact that most cases are mild, and most people recover. Reports about the coronavirus likely sound very scary, so it's understandable that you'd be afraid. However, 80% of cases are mild, and some people don't even realize they're sick. Additionally, most people who get very sick will get better, so try not to worry. Finally, some areas don't have any confirmed cases, so you may not be at risk at all. COVID-19 causes respiratory symptoms like fever, cough, and shortness of breath, similar to the common cold or the flu. Coronavirus infections are rare in children, so you don't need to be especially worried about your kids getting sick. With preventative actions, such as hand washing, kids are at low risk. Tip: most people are at a low risk for complications, so try not to worry. The reason why governments and news organizations are encouraging the public to stay home and take preventative measures is that the virus spreads easily and may be harmful to a small group of high-risk patients. By taking steps to protect yourself, you can also protect your friends and loved ones. 4. Share helpful information with friends and family. You can help yourself and others feel calmer about the coronavirus outbreak by sharing any helpful information you find. If you see a useful update on the coronavirus from a reputable news source or government website, post a link on social media or email it to any friends or family members who are worried about the virus. If you stay calm and stick to sharing factual information, you can set a good example for others and help prevent panic and anxiety from spreading. If you know anyone who is spreading inaccurate information, correct them in a calm, non-judgmental way. Say something like, "I know a lot of people are saying it's not safe to handle packages from China, but the WHO says the virus dies quickly on objects like mail pieces." Provide links to back up any information you share. Tip: the World Health Organization maintains a Mythbusters page that covers common misconceptions about the COVID-19 outbreak. If you read something you think might be inaccurate, you can check it out there.